Is Dr. Spinder Kour, and today I am going to present my study, that was comparison and association of dermatoglyphics and dental anomalies among 3 different regional populations of India. But before starting, I would like to thank SciTech conferences for allowing me to speak on my study. So the aim of our study was to evaluate and to find an association between dermatoglyphics and dental anomalies. Now, as our study took place in India is a diverse nation and various races have settled here with time, resulting in multicultural diversity of the India. Then different populations in India have shown different morphological features. For example, if we see, we took 3 different regional populations. The first one, the group A, consisted of northeastern population. Group B consisted of UP West population, and group C consisted of Jammu and Kashmir population. Now, if we see the northeastern people, they have an ethnicity which dates back to Mongoloid or Eskimoid races. While as the UP Western population, UP is one of the biggest state in India, and it consists of people from different ethnicities, different races. And UP people, they have a lineage of Indo-Aryans and Indo-Scythian tribes. While as the Kashmir, which was invaded by various rulers from Persia, Afghanistan, so they have a lineage which dates back to Indo-Greeks, Indo-Afghanis and Persian people. We can see the presence of those people, the features of these peoples are different as compared to other people. While as now in our study we took about 200 subjects in one population. So we took 200 cases from Northeast, 200 from UP West and 200 from Jammu and Kashmir. So the model of our study, what we did, first of all, when a patient, we selected, randomly patients were selected, and then we explained them our study, and after getting an informed consent, we asked them to sit in a dental chair and they were examined, their mouth was examined for any dental anomalies. After that, patient was asked to sit in a relaxed position and they were asked to rinse their mouth, and then after taking the measurement of the tray, alginate was poured and impression was taken. After that, a cast was poured from that impression, and it was kept aside. While as for fingerprints, what we did, we asked the patients to clean their hands with the help of a sterilium, and then with the help of an ink pad, ink was applied equally to their hands, and their hands were pressed against a white paper, applying equal pressure on all the fingers. Then when we got an adequate impression, we asked the patient to wash their hands. After that, so this was our procedure. Now, what we found out, the results of the study was very different. The basic results, if I tell you, it was that the rotation was the most common dental anomaly just seen in all the population. Gender distribution, it was, in our study, it consisted of 65.6% females and 34.3% males. Females are slightly higher than males. And then the rotation was the most common anomaly which was detected. Rotation consists of northeastern people, there was 41%, UP 45 and JNK 36.5. So rotation, we can say, according to our study, rotation is an anomaly which can be seen very commonly. Then showling. Showling was an anomaly which was seen only in northeastern group, and it was backed with the research because showling is a characteristic trait of Mongoloid races. It is not seen in other races, or even if it is seen to very less extent. But showling is commonly seen in Mongoloid races. So same was seen in our case also. Then gemination, we also saw the gemination case. This was also seen in Mongoloid races, in northeastern group only, group A. While as the missing tooth was the common, and according to literature, missing tooth is the commonest dental anomaly seen in the world, which consisted of about third molar first. But here we also saw in JNK population, the missing tooth was the commonest anomaly. While as the winging was seen most commonly in UP Western population. So we can see the showling, it was seen only in northeastern population and small amount of UP population, while as in JNK population we didn't found any cases of showling. Congenitally missing tooth was seen most commonly in JNK. The blue one is represented by northeast and orange one is the UP West population. Now the main feature of find the association, or coming to the association. So we found that the Shaolin had an association with the whirl pattern. Whirl pattern means it's a fingerprint pattern in which we can see the concentric circles. So whirl pattern was associated with the Shaolin, while as this rotation was commonly seen in the ulnar loops. So this is an ulnar loop, and it was most commonly seen in the cases with rotation. So the present study was conducted to check the relationship between the dermatoglyphics and to use dermatoglyphic as a predictive diagnostic tool for dental anomalies in order to apply for preventive and interceptive treatments to the higher risk groups. So accordingly, if a patient is diagnosed with the, we can see like dermatoglyphics and dental anomalies, they develop around the same time, like it's 4 to 6 intrauterine week. So if a dermatoglyphic pattern, we can see the dermatoglyphic pattern of a patient, of a child, and then we can assess that in future this child may be or is in a higher group of having dental anomalies or higher risk of dental anomalies. So we can apply the preventive techniques in the earlier days, which can result in lessen malformations. So this was the one thing. And the second thing was that if dental anomalies, because teeth are the things which don't get destroyed easily, even if in case of a mass destruction, for example an airplane accident or a collapse of a building or any other mass destruction cases, in that cases only if dental remains are there, we can identify from the morphological features if that person belongs to which place. So we took these